don't we get started with introductions, and then we can see if we have a quorum to move through some of our business. So good afternoon, everyone. Thank you for joining the Sexual Assault Forensic Examiners Advisory Committee meeting today. This meeting is being recorded and will be available for viewing on the Judicial Branch YouTube channel. So with that, I will call the meeting to order at 2:04. I will start by introducing myself. I'm Mary Kazicki, Director here with the Office of Victim Services. And I will go around. Brittany, would you like to introduce yourself? Oh, I'm sorry, sure. Rachel, did you have a question? Rachel, I think you're muted.
I don't think we're recording.
Oh, I'm talking and my mic's not on. I do have the judicial meetings in here, so it should be recording.
Oh, okay.
Thank you, Janet.
You're welcome.
Brett?
Hi, good afternoon, everybody. I'm Brittany Kaplan. I am the staff attorney for external affairs at Judicial and the legislative liaison for the branch.
Nice to see you, Brett. Thank you.
Nice
Karen?
Yeah, Karen Jubinik. I am an emergency physician. I work at Yale New Haven Hospital.
Great, Karen. Thank you. Sevi?
Hi all, I'm Sevi Papakanakis. I'm the Deputy Director of Forensic Biology and DNA at the State Forensic Lab.
Thank you, Sevi. Beth, good afternoon.
Good afternoon, everyone. My name is Beth Hamilton. I'm the Executive Director of the Connecticut Alliance to End Sexual Violence.
Nice to see you, Beth. Thank you. Kim?
Hi, I'm Kim McKinnon, and I'm the SAFE Training Program Manager.
Thanks, Kim. Marielle?
Hey, greetings, everyone. Marielle Daniels. I'm the Director of Regulatory Advocacy for the Connecticut Hospital Association, and it's nice to see folks.
Thanks, Marielle. Cindy?
Good afternoon. I'm Cindy Theron. I'm Assistant Director for Judicial Branch Legal Services, and I am Denise Poncini's replacement.
Nice to see you.
At least for now.
Welcome. Thank you, Cindy. Kristen? Kristen may have trouble unmuting, so I will come back. Rachel?
Hi, everyone. Rachel Henderson, Safe Response Program Manager.
Thanks, Rachel. Kristen, are you able to unmute? And is there anyone else on the call that I did not acknowledge? Janet Mantello is Administrative Assistant with our SAFE program. Janet, thank you for all of the assistance and support you provide to our meetings.
You're welcome.
Okay, Kristen, if you're able to unmute at any point, please feel free to just let me know, and we can have you introduce yourself as well. Everyone should have the agenda and minutes from our last meeting, November 20th. Regarding the agenda, I just want to note, as Janet had mentioned, Robin Tauzi-Ayers did make a request that we move that item down to the end of the agenda. She was going to be a little bit late in her capacity to join us today. So if we get to that agenda item and she's not been able to join yet, we'll just move that a little further into the agenda for this afternoon. Did everyone have an opportunity to review the minutes, and are there any suggestions for revision or edit? No, and I do just want to double check. Do we have a quorum?
I believe we do. Let me just double check myself.
Thank you, Janet.
I am showing that we do. We should have at least 8 in here, and we need 7 for the quorum.
Thank you. I appreciate that, Janet. Is
You're
there a
welcome.
motion to accept the minutes? Thank you, Savvy. Is there a second?
In second.
I'll sec-
Thank you. So moving on to item 3, update from the Safe Response Program Manager, Rachel.
Hi, everyone. It's been a really good 2024. I've been updating at the last several SAFE Advisory Committee meetings, our numbers for the SAFE program. We currently have 25 active SAFEs, 2 preceptees, 3 are on leave of absences, and 4 are in inactive or restricted duty, giving us a total of 34. That is up from the 29 we had in the June of 2024 updates. Additionally, we've had contracts with Bristol Hospital and Waterbury Hospital that have added to the training aspects of our program. And most recently, with the metrics that we're observing for the Safe Response Program, looking at the percentage of cases that we cover each month has always been a struggle. So based on the activations and the staffing, we are observing the percentage of cases we were able to respond to over the years. The last time a SAFE program has achieved 100% response was in July of 2020. And I am excited to say that and share that we were able to respond to 100% of the cases in January of this year for the first time in 3 years, which is a huge accomplishment and completely due to the fact and the dedication of the SAFEs that we have in our program. There were 8 activations and we were able to attend all of them. The SAFEs have really gone above and beyond with their participation with the program and trying to do as much as they can to meet the needs of the hospitals that we serve. So I just want to give credit and kudos to all the SAFEs in our program for their outstanding dedication and work, and we continue to move towards that goal of making sure that there's a SAFE for every patient that needs us. So thank you. That's all I have.
You're muted, Mary.
Thank you, Marielle. Thank you, Rachel, for that update. I appreciate it. Any questions for Rachel on that? Okay, moving to the next item, Kim, update on our training program.
All right. So every 2 years, our SAFE training course has to apply to the International Association of Forensic Nurses to be reaccredited for both the continuing educational credits that we offer for the didactic portion of our course and for the seal of approval, which is the stamp that we put on our certificates. And that stamp indicates that our course aligns with the IAFN educational guidelines. And I'm really happy to say that we prepared the application. We got it in 2 months early, and we heard back within a week that we got approval again for both, the CEs and for the stamp of approval. So that is huge. And we are accredited now through March of 2027. So woohoo, happy about that. The next thing is our annual competency day. And we host those trainings for the SAFEs that work in the hospitals as a continuing educational unit for them so that they can maintain their practice. And each SAFE has to come to these trainings once a year. We usually host about 12 of them. And then at the end of the year, we end up trying to host a few more just to get people through who didn't make it throughout the year. So we have emailed all the SAFEs in the state of Connecticut the dates now for the training. And this time around, I sent emails to all the managers of the units in the hospital so that they're aware of when the dates are and they can encourage their SAFEs to sign up. We created a forms doc for that. They got the QR code and the link, and we have people actively signing up right now for our training. So I'm excited about that. We're going to be proactive about it, and Janet, who's on the call right now, the administrative assistant, is going to be emailing out routinely just to kind of keep people kind of in tune who haven't signed up and entice them to sign up to come. So that's the annual competency day. Next on the list is our spring class. And it amazes me that it comes around so fast. I feel like we just finished the fall and now already we're coming into March for the spring. We start day one of the class on March 19th. We have about 25 or 26 presenters for us. They've all agreed to come back and train with us, which I'm excited about. We have 32 people who registered for the class, which is great. It represents 11 hospitals across the state of Connecticut. Of those 32 people, 7 of them are joining Rachel's Response Program. And then we have 2 additional people from the fall class who got so excited about the talk that we did about the response program that they're now coming in and joining the response program. And the good thing about that is that they've already been trained as SAFE. So Rachel's going to be able to kind of fast track them right into joining the response. So a total of 9 people now are going to be added to Rachel's list. So that's huge. And then finally, we're trying to increase access for nurses to take the training with us. And we are examining avenues, the process of examining avenues of holding our biannual training in a different location to see if that's going to allow more people to actually participate in our trainings. And right now we're in the initial stages of exploring opportunities with healthcare facilities to see if there's an interest with joining us in this opportunity and partnering with us to host these trainings. So a lot's kind of going on with the training program. And that's about it on my list.
Thanks very much, Kim. And I do just want to acknowledge the resources and effort that goes into that accreditation application every few years when that is due. It really is quite an undertaking. And I really just want to recognize your efforts and Rachel's in completing that application and working through that process and the communication with IAFN to ensure that we have that accreditation again to be able to offer the CEUs and to have that stamp of approval as one of a limited number of accredited SAFE training programs across the US and Canada. So thank you both for your efforts on that. I really appreciate it. And the annual competency day, as Kim mentioned, really trying to improve access to that as well, spreading that out throughout the year rather than as it was focused during the summer months, trying to make that more accessible and easier for our trained SAFEs across the state to maintain that competency. And with the addition of the QR code and the link, just really looking to find ways to connect, to maintain that connection and to offer those opportunities in the easiest possible way for our SAFEs to be able to continue to maintain their competency. So thank you very much, both of you, for all of your efforts with that. Any follow-up questions or thoughts around the training program? All right, we are at the discharge packet. Has Robin joined us, Janet?
My mic was off. No, I do not see her on here yet.
Okay, all right, we'll come back to that. The update on the sexual assault evidence collection kit, revisions and technical guidelines. We started with an RFP around the kit and did not receive responses that were able to be evaluated to that RFP or request for proposals. And so we transitioned to a request for quotation instead. That was originally scheduled to close on February 11th. It was extended 1 week until yesterday, February 18th. And I have been in contact with purchasing and I'm awaiting an update as to the status of the request for quotation, responses that we may have received, and next steps. So we'll certainly keep everyone up to date on that as we move through that process. And as I've mentioned in the past, as soon as we are able to determine which version of the kit we will move forward with, there were 2 versions that had been identified, one including an FTA card for collection of blood and one that maintained the traditional blood draw. And so we asked for quotation on both of those kits. And once we have identified which version we will be moving forward with, we will then be working with the commission to complete the revisions to the technical guidelines that will be necessary to mirror the kit that is the one that is selected for utilization. And in addition, the technical guidelines will then be updated to reflect any necessary revisions and the appendices within those technical guidelines. So certainly we are closing that process around the request for quotation and look forward to those next steps and completing those revisions to the technical guidelines as well. Any questions on that? Okay, moving on to maintaining a safe certificate. So as Kim mentioned in her training presentation, the annual competency day is the pathway for trained safes to be able to maintain their certificate as a safe and be able to sign safe after their name when they complete an evidence collection. So we have been seeking to identify ways to potentially expand the available pathways to maintain that certificate as a safe. There is an incredible commitment on the part of healthcare providers to complete that training, and a commitment on the part of Kim and Rachel to host the annual competency days. And they have been very effective as ways to, as Kim said, maintain currency and competency in the practice. But what we're recognizing, and as Rachel discussed at our last meeting, is that there is some challenges to being able to attend those annual competency days every year and to have those trained healthcare providers able to maintain that certificate as a safe. And so recognizing that, we have begun discussions around, are there other pathways that could be utilized to maintain that certificate, and what might that look like? And so at our last meeting, Rachel gave a presentation around some potential opportunities that might be able to be explored through a combination of training and currency and practice, and how we might be able to incorporate different methods of maintaining that currency of practice and in turn maintaining that certificate as a safe. And so we wanted to come back today. We had that discussion at the last meeting, provided the materials that had been shared, and would like to open the discussion to, is this an avenue that we think as a committee should be explored? And if so, what would those next steps be in identifying opportunities that we would like to explore further? And so that's just kind of an overview. Rachel, are there other pieces that you would like to add to that before we open for general discussion on this?
I'll leave it up to the committee and yourself, Mary. I can give a brief overview about what was discussed at the last meeting. I don't know if everyone is familiar or wants or needs a refresher. It's up to you, whichever works for the group. I'm okay with either one.
I think a broad overview would be helpful to our discussion this afternoon. So if you wouldn't mind, I think that would be great. Thanks, Rachel.
All right, I'm just going to share my screen so that we can at least see, basically have a visual to go along with what we were discussing. If everyone can see that main screen. So this is just a visual representation of the current pathway to competency. And so as you can see, the two different paths are really hospital-sponsored applicants and safe response program applicants. And they follow that one continuous line of gathering the safe certificate, going into the annual competency day cycle. But then if anything is left off or an annual competency day is missed, then you have to return back to the beginning and start the process all over again. There's no alternative pathways to achieve your SAFE certification. And the maintenance pathway is still that same revolving door. So it doesn't allow for differences in practice, experience, and so forth. The proposal and the theory behind it was for this, and then this is the pathways. I'm going to go over to the standards for maintaining a certificate. Can that you're seeing the right screen for me if you can. Okay. So really, if you look at the black titles at the top of each of the categories, this is what Mary was referencing, where currently the annual competency day being completed each year annually has been the single criteria for maintaining competency, not taking in continuing education opportunities, QA, or other things a SAFE may be doing on the side if they're taking their APRN or other advanced nursing classes that could be considered for continuing education related to SAFE practice, active clinical practice too, working as a SAFE in their primary hospital. And then if they have any other certifications such as SANE through the IFN, which would be an additional achievement. So allowing for each of these different criteria to potentially add to the quality of SAFE and offer a different opportunity, and then create these different clinical pathways over a 3-year period to then achieve the SAFE certificate renewal, allows some flexibility for the individual SAFEs based on their own experiences. And then this would be the criteria and the different tiers that we had roughly put together. And then it would then look as the pathways, as you can see, split between that one single line into each of these being interchangeable, so that no matter where you are, although it is a little complicated, it allows for multiple different ways to achieve the SAFE certificate while still taking into consideration practice, training, and other things. Does anybody have any questions about why we have chosen this as a target, or any thoughts, even if it's just this seems complicated or open to criticism? Really, that's what we need, is we need to identify where there are opportunities to do better within this, or any concerns that changes like this may create unknowingly based on your own practice and experience. And I'll stop sharing.
Thank you, Rachel, for that overview, and really appreciate the effort, again, that you and Kim have put into the discussions around what might be other opportunities to explore to be able to maintain that currency of practice, and to be able to demonstrate competency, and to be able to maintain that that SAFE certificate. And these are our initial thoughts, initial ideas about other things that we might be able to consider as an alternative to the current singular pathway, as Rachel noted, which is that annual competency day, and is required once a year, every year, and you must be able to attend 3 of those and then have that certificate renewed. And so as Rachel shared at our last meeting, and I think was really one of the points that that resonated in our discussion, is that you can have a SAFE who is practicing currently, is doing a number of cases consistently, but has an individual situation that prevents them from being able to attend an annual competency once during that 3-year period, and then they would not have a different opportunity to be able to maintain that SAFE certificate. So even though they are practicing, they are responding to cases, they are maintaining their currency with the practice, they're attending QA, they're attending training, the only current pathway is to attend those 3 annual competency days during a 3-year period. And so that really was the the motivation for this conversation is to try to find other ways that we might be able to recognize currency of practice and competency to reduce that dependence on a singular pathway. Marielle, I see your hand. Thank you.
Hey, everyone, I just apologize. I missed the last meeting, so this is my first time kind of seeing it. And so I think I've been always supportive of the program coming up with creative ways to keep safes working here and active, right? I mean, as you know, Rachel just said earlier, we're seeing progress. We want to continue to see that progress. So to me, as long as OVS doesn't feel that it's burdensome for you to create these alternate pathways, you can support them. This is a step in the right direction for the SAFE program, in my opinion, to be able to continue to train and keep trained folks, current and active. And like you're saying, Mary, if it's giving flexibility to people who need it, then I don't see any downsides to that, at least today. Obviously we haven't issued nobody's gone through it. And there may be some unintended things that we'll all be able to fix going forward. But I'm very supportive of it. It's my overall RG statement.
Thanks very much, Marielle, and thank you for acknowledging that there may be a number of things that we need to very carefully consider as we move through this. Identify, is this moving towards our intended goal? Are there any unintended consequences that we may create? What is the resources that will be necessary to be able to monitor and ensure compliance with alternate pathways that are developed? So there are a number of considerations as we move forward. But just excited to be beginning the conversation about, are there alternative pathways that we can identify, develop, and feel comfortable utilizing to really expand medical healthcare providers' opportunities to maintain that certificate. Other thoughts around this, other initial reactions? Marielle, thank you for indicating that you feel it is something that we do want to continue to discuss and find ways to identify options. Are there other thoughts around that? Do we as a committee feel it is a conversation we want to engage in and seek to identify alternative pathways? And if so, what might be next steps? So I think I'd start with the first part of that question. Do we think as a committee that this is a direction that we would like to pursue and put energy and effort into trying to identify options and then further explore what are the considerations within those options?
I'm hesitant to say yes to my own preference, but I make a motion to move forward with this as an opportunity to engage SAFEs that have gone through the training program. I do acknowledge that I think Marielle is right. There's a lot of considerations for what kind of burden would that place on us for maintaining and observing competency. I'm actually interested in DPH's perspective on other certifications and what's the standard. A lot of our places is that it is the autonomous responsibility of the individual to maintain their own records for competency and submit that singular application. So placing the burden of responsibility in this scenario on the individual is a theory that we're working with. Also, I'd be curious as to what people think of that as well. I've also heard that other people say that the burdens that we're putting on our SAFEs to maintain their competency is far greater than that and other similar roles for nurses. So any thoughts on that as well? I don't know if Kristen's got her mic off.
I know we talked about this last time, and you're hearing me say this multiple times today, Rachel, but why not look at it all? I mean, why not use it as an opportunity to just sort of look at, like, the field has changed a lot since a lot of this stuff was created and we really thought about this model. And also I think the resources that are available to people have changed. And so I would say, which I know I said last time, but just look at everything while you're looking at this and identify the best pathway forward. And I'm sure you'd have all of us supporting any kind of dive that you want to do on any of these areas. I know we talked more when we were at OBS last time, but I think it all makes perfect sense from where I sit.
Thanks, Beth.
Thank you, Beth. Kristen, I see your hand up.
Yes, I am here.
Hi, Kristen.
Sorry, I was driving before, I couldn't unmute. And now my camera doesn't work, but aside from the technical difficulties, hello everyone. I am Kristen Loringer. I am a safe nurse with the program, and in this capacity, I'm representing the IAFN. I'm currently the secretary for the Connecticut chapter. So hello. As far as the competency, I just think that it's hard to pick one pathway or way to do things because, as we know, you can't predict when you're going to have cases. So to say that someone needs a certain amount of cases or a certain amount of, it's just hard because you don't know what capacity people are working or not working and when or if a case comes along. So I think having different options to remain competent is a good idea. I like the idea of having people take responsibility for themselves. Like someone else said, you know, there's other certificates that people hold in nursing, and you know, you have to get your own continuing education credits and things like that. So I think keeping the options open and also putting some of the, at least some of the responsibility on the safe nurses is a good thing to do. So maybe a combination of both, like have the yearly dates available, and then also maybe continuing education credits or opening up our monthly meetings, the QA, to all of the nurses that have been trained through the OVS program, not just the response program, things like that. So they have other opportunities.
Great, thank you, Kristen. So Rachel, I heard you phrase your opening statement with making a motion. And I just want to confirm with Janet, we do have a quorum?
Yes, we do.
Okay.
And I am showing, I believe Robin is here now. Her camera's just not working.
Oh, great. Good afternoon, Robin.
Hi, I'm here.
Did you want to just briefly introduce yourself as well?
Sure. Let me see. Okay, mic is on. Hi, this is Robin Tauziers on my state issued laptop, and the camera's not working. So I'm in the Office of Injury and Violence Prevention, which includes sexual violence prevention. So that's why it sits there. I work on other projects as well, but I've been specifically working with you all on completing the brochure for the victims of sexual violence. Sarah, you know, Sarah has, Moriarty has also been co-attending these meetings with me. So the two of us are your go-to people here at DPH for this.
Great, thanks very much, Robin. And
Sure.
we did move over the agenda item on the pamphlet, and so we will move back to that as soon as we finish this discussion. So really glad that you're able to join us. Thank you.
You're welcome.
So with that, Rachel, did you want to make a motion to?
Yes, if that's a possibility, Mary, I would want to make a motion that we move forward with whatever the next steps might be to consider alternative pathways to competency and maintaining a safe certificate, whatever this committee feels like is best next steps, whether that is uh, a formal revision and review of draft documents or a subcommittee. I'm okay with either of those.
Okay, so just to clarify, the motion is to explore developing alternative pathways to maintain a safe certificate in Connecticut.
Correct.
Okay. All in favor?
Aye.
Aye.
Aye. Any opposed? Any abstentions? Okay. Motion passes. So we will continue this discussion in thinking about what potential next steps might make the most sense. Rachel, I can want to acknowledge the work that you've put into drafting some potential opportunities for discussion in the materials that were provided at the last meeting. I wonder if reviewing those pathways that you have drafted and perhaps receiving some feedback on those, or any additional thoughts on other pathways that we might choose to explore as well, might make sense as the next step.
Yes. I also do feel like there may be an opportunity to engage safes within the program, if that's a possibility related to this committee, or if you want to just keep the feedback from this committee themselves. I feel like we're limited on the number of safes, but it's up to you. It's up to the committee, however we want to pursue it. But I do feel like feedback outside of on the draft material would be helpful.
Yeah, I agree.
I agree as well. And there may be ideas that our trained safes may have around pathways and opportunities to demonstrate currency and competency that we may not think of. So thank you, Rachel, for raising that. I think that that's a very valuable avenue to pursue, not only to receive feedback on ideas that have been identified and begun to be explored, but also to identify potential other options and opportunities that we have not yet thought of. So perhaps as a next step, then we could all review the materials that were distributed from the last meeting that include a description of some draft ideas around how we might further develop alternative pathways and bring feedback. Perhaps we could request feedback a month from now on that. And perhaps that would give Rachel and Kim an opportunity to explore conversations with safes as well, maybe at a QA meeting or another forum, to elicit some additional thoughts and feedback from our safes. And then we could, based on that feedback that we receive, maybe even if we asked for by the end of March, by March 31st, to have feedback on the materials that have been distributed. And Rachel and Kim, if you have additional feedback from the safes, to share that as well. And then as a committee, we could just decide via email discussion what might be the next step prior to our next meeting, which is scheduled for May 14th, to continue the conversation and come back in May, perhaps with some more definition around potentials that have been identified that we would want to really dive into and begin to identify the benefits or any potential challenges in moving in any of those directions.
Sounds good.
Okay, so that's what I would suggest then, that if we could all review the materials that were provided at the last meeting and share thoughts around those materials via email with the committee email by March 31st, and then we can determine what makes the most sense for next steps. In addition, feedback from the safes, Kim and Rachel, that would be really great. Other thoughts before we close this agenda item? And thank you everyone for your input and thoughts and feedback on this. Okay, then Robin, that brings us to you and an update on the pamphlet, please.
I'm here. So here's where we are. We're like close to the final version finally. It's right now with Converge with we had additional input from our HIV unit here on website links that have changed, et cetera, et cetera. So Converge, that's the marketing company, is saying they will have it back to us by Friday. One thing that, and Beth knows about this discussion, one thing that's come up over and over again is the information in the brochure, particularly regarding links to websites, phone numbers, and QR codes. What do we do about that? And I don't know if you were at the meeting, Beth, Sarah Moriarty was there maybe last week or the week before, and people kind of feel that we need to be inclusive of everyone's technical capacity, so that we want all three in there: phone numbers, websites, and QR codes. So that's our last step here. We found some web links that are no longer working. We had to take some information out because there are links that are no longer working. So unfortunately these days that's an ongoing process of links that aren't working. So this is kind of our final step. We have to have it approved by our Office of Communications, and then the decision was that that the different organizations would print the brochure as needed. Other than that, it will be available electronically for people to print off as needed. So we felt that due to the quickly changing nature of websites and phone numbers and information, doing a large print job would not be a very productive idea at this point. So hopefully I'll be able to, when we meet again, May, so hopefully I'll be able to send it with draft printed over it out to the group so they can look at it before the May meeting.
Fantastic. Thank you, Robin.
Yes, it's been a long ordeal.
Indeed, we appreciate your commitment. Thank you very much.
Yeah.
Okay, that brings us to new business. Any new business that anyone would like to raise or discuss? No, hearing none. Well, thank you, everyone. We appreciate the input and the feedback on the SAFE certificates, and excited about our increase in response, our increase in number of trained safes, our exploration of potentially bringing the SAFE training program to other areas of the state to increase access, and looking forward to the conversation around pathways to maintain a SAFE certificate. So we will send out the materials again just to ensure everyone has them. Janet, if you could include that with the communication from this meeting with the minutes, just to be sure everybody has those materials, and look forward to everyone's feedback by March 31st, please. Hi, have a great afternoon.
Thank you.
Thanks, everybody.